Hello.
Okay. Hello, everyone. So, good morning on today, which is Global Accessibility Awareness Day. So, it's my pleasure to welcome you to today's community of practice. I'm Ilan, your facilitator for today. Would love, let me just give you a quick sort of overview of my visual description and about myself. So I'm an Asian woman from a Canadian background, and I'm wearing a blue shirt and glasses. I have long dark brown hair, and I've got behind me the San Francisco Bridge. I'm an Asian woman with a disability. I grew up in Vancouver, Canada, where in the Chinatown district. Work-wise, I have worked for 20 years in international business and customer experience, including as an executive director in the corporate and public sectors. I even ran diversity training for the United Nations of Australia, Queensland, and I'm currently a public panel member of the Queensland Civil and Administrative Tribunal and a Queensland Disability Reforms co-designer. Fun fact, I was the master of ceremonies at a corporate ceremony in Japan involving the former US Secretary shaking the paw of an English sheepdog. So we acknowledge the traditional owners of the lands on which we meet. We pay our respects to the elders, past, present, and emerging, and acknowledge the important role that Aboriginal and Torres Strait Islander people continue to play within the community. QDN also acknowledges people with disability who have come before us and died in institutional settings, as well as those who are still trapped in institutions or silenced by institutional practices. We take on the responsibilities of being clear about the rights of all people with disability and, where necessary, speak in an informed and considered manner for those who cannot speak for themselves. We acknowledge the significant contribution of Queenslanders with disability to the Royal Commission into violence, abuse, neglect, and exploitation of people with disability and the independent review of the National Disability Insurance Scheme. So a bit about housekeeping before we start. To turn on the captions, press on the closed caption button in the bottom middle of the screen and then click Show Subtitles. We also have two Auslan interpreters joining us today, Cornelia Ratima and Sue Gossis. Thank you for joining us. If you need to see the interpreter, you can click on the video of the Auslan interpreters and select Spotlight or Pin. And if you have any technical issues, please call us on 1-300-363-783 or put a message in the chat. So today's session is being recorded and will be uploaded to the QDN website. So for safety, we all want you to know that this is a safe place, and we encourage you to ask questions and share without fear of judgment. There's no such thing as a silly question, and there are no right or wrong answers. The QDN team is really committed to continuous improvement and encourage you to keep sharing your thoughts. We'll put the link into the feedback survey in the chat at the end of this session. So this is our fourth virtual community of practice. We hold these once every quarter to help build the capacity and connect across the sector for co-design, which is a key pillar of the stakeholder engagement and co-design strategy. The key aims of this community of practice are to share knowledge, develop skills, problem solve, discuss innovation and best practice, strengthen a sense of connection among members who share similar goals, values, as well as lived experience. as well as foster continuous improvement in co-design processes. So let me introduce Amparo Advocacy. Today's topic is what meaningful co-design looks like when language, culture, and disability intersect. It'll be presented by Angie Boyd and Condi Noma from Amparo Advocacy. Amparo is a statewide not-for-profit organization that's dedicated to standing up for vulnerable people from culturally and linguistically diverse backgrounds. Amparo is a project partner with QDN's stakeholder engagement and co-design strategy. So, about the presenters, I have the pleasure of introducing our guest presenters who will tell you more about Amparo Advocacy. So Angie Boyd brings over 20 years experience in human and community services and has spent the past 3 years with Amparo Advocacy delivering independent and systemic advocacy. Her work includes facilitating the Inclusive Leadership Network and leading a culturally and linguistically diverse inclusive project that strengthens lived experience leadership and co-designs culturally responsive advocacy tools for governments and community organizations. Condi Noma is originally from the Democratic Republic of Congo. Before he moved to Australia, he'd been living in Cameroon, where he spent more than 20 years as a community worker, in other words, a coach, providing organizational and technical support to disadvantaged or vulnerable communities, empowering them to solve community problems or claim their rights. And those were mostly people with intellectual disabilities. He arrived in Australia about 3 years ago with his daughter, who has an intellectual disability. He's studying English at TAFE and enrolled in community services courses while struggling to make a way for her daughter's fulfillment. Sorry, his daughter's fulfillment. His vocation is to help build a world where all people are free from social barriers and empowered to face life's natural challenges. I'd like to hand over now to Angie and Condi with their presentation today, focusing on co-designing with people from culturally and linguistically diverse backgrounds. After their presentation, we'll have a few minutes for questions. If anyone has any questions about the presentation, please put them in the chat or raise your hand after the presentation has finished. Okay, over to our lovely presenters.
Okay. Bonjour à tout le monde. Mon nom est Condé. Je suis arrivé en Australie avec ma famille il y a 3 ans. Ma fille a 24 ans. Elle présente un handicap et a besoin chaque jour du soutien total de ses parents. Lorsque nous sommes arrivés en Australie, cela a suscité un grand espoir en nous. Nous étions convaincus que notre rêve pour elle allait enfin se réaliser. Elle aurait enfin l'opportunité de s'épanouir. Mais arriver dans ce nouveau pays n'a pas rendu les choses faciles. Nous nous sommes retrouvés face à un autre système très complexe, un système que nous ne pouvions pas comprendre dans une langue que nous étions en train d'apprendre, et avec des documents et des rapports médicaux rédigés bien sûr par des spécialistes mais en langue française qu'il fallait traduire en anglais, ou au moins les remplacer et les recommencer d'autres documents. Parfois, nous savons ce qu'il fallait faire eu égard à notre passé, à notre expérience, pour faire progresser la démarche, mais nous ne pouvons pas l'exprimer assez clairement aux gens qui voulaient nous aider afin de pouvoir faire progresser le dossier. En plus, le processus était trop rapide souvent, très déroutant. On ne nous laissait pas assez de temps pour l'interprétation. Parfois, il n'y avait pas d'interprète. Et même quand il y avait l'interprète, parfois, le fond n'était pas, le fond était perdu. Donc, nous n'étions pas complètement bien compris. Pour des familles comme les nôtres, Le handicap n'est pas seulement une chose vécue par un individu. Il affecte toute la famille. Il modifie, il affecte notre façon de travailler, de participer à la vie communautaire, de prendre des décisions, d'imaginer l'avenir. Nous sommes venus en Australie avec beaucoup d'espoir. Nous avons toujours de l'espoir, nous gardons cet espoir, mais l'espoir ne suffit pas si les systèmes ne sont pas conçus de manière à ce que des personnes, des langues, des cultures et d'expériences différentes puissent les comprendre, les utiliser et les influencer. C'est pourquoi une conception significative est importante. Il ne s'agit pas seulement d'être invité à la réunion, il s'agit de veiller à ce que, de s'assurer à ce que les gens puissent véritablement participer, être compris et de façon à aider à façonner le système dont dépendent leur vie.
My name is Conde. I arrived in Australia with my family 3 years ago. Our daughter is 24 years old. She is disabled and she needs everyday full support from her parents. When we arrived in Australia, we had great hope. It sparked great hope for us. We were convinced that the dream we had for our daughter would finally come true, that she would have the opportunity to bloom. But arriving in a new country didn't make things simple. We faced a different system, a complex system, a system that we didn't understand in a language that we were still trying to learn, with documents and medical reports in French language that had to be translated or replaced. Sometimes we didn't know what we had to do to make things progress, or we didn't know how to explain it clearly to the people who wanted to help us. And sometimes the process was too fast, too overwhelming, or didn't leave us enough time for interpretation. Even when we had an interpreter, everything that we wanted to say was not fully understood. For families like ours, disability was not only something that we had to go through, it impacted the whole family. It changed our way of working, of being participating in the community life and taking decisions and thinking about our future. We came to Australia with hope. We didn't always have hope, but hope is not enough if the systems are not made in a way that people from different languages, culture, and with different experiences were able to understand it, use it, and influence it. That is why a co-design is very important. A meaningful co-design is very important. It's not only about inviting people to a meeting. It's about making sure that these people could actually participate, be understood, and help them to change the system their lives are depending on.
Thank you, Conde and Aude. My name is Ange Boyd, and I'm really pleased that Conde and I are here with you today. So I'd like you to take a minute. What you just had was a brief experience of being in a room where the speaker was using a language that wasn't yours. You were still present. You may have wanted to engage. You may have been trying too hard to understand, but the way into the conversation was partly or completely closed. I'd like to invite a few quick reflections, if I may, and feel free to put them into the chat. So what did you notice in yourself? What did you do to try to understand? What would have helped you participate? It would be, really great to hear a couple of comments. People would like to add those in. Sorry, I've opened the chat. Anna, are you able to?
Yeah, sure. So we have Seb Thompson. He says that French-speaking language sounded really beautiful, which reminds me to watching SBS. We also have Shannon McCann. I was desperately trying to find a way to understand, and I was looking up whether live translation existed in Zoom. And
Yep. So good. Thank you. Thank you. So what you experienced for a couple of minutes is something Condi's family navigates every single day, not in a workshop, but in a planning meeting with the NDIS, in a specialist's office, at a school, in a complaints process, and the stakes are much higher. If the communication fails in those settings, it may mean that the person does not get the support that they need. It may mean that their rights are not understood. It may mean that the family, Condi's family, are left to carry impossible responsibilities alone. What we heard through our Amparo advocacy is called the engagement plan co-design process is that this is not just about language. People spoke about being invited into consultation too late, being spoken to in jargon, being treated like a diversity tick box, and never hearing back about what happened to their input. That is not meaningful engagement. That is closer to extraction. So today, we want to explore what it looks like to do this differently. What meaningful co-design requires when language, culture, and disability all intersect. And the best person, again, to start that conversation is Condi because he's living it. So Condi, I'd once again like to invite you to share a bit more about you and your family's journey, what's been like navigating these systems and what's helped and what's got in the way.
Ok, merci beaucoup. Lorsque nous sommes venus en Australie, je dis, nous sommes venus avec beaucoup d'espoir. Dans le cadre de notre pays d'origine, notre fille bénéficiait de soutien de différents spécialistes et éducateurs. Mais le système manquait de ressources, d'équipements ou de services pour répondre pleinement à ses besoins. Tous ces spécialistes et éducateurs nous disaient que si elle pouvait vivre dans un pays doté de meilleurs services, elle aurait de meilleures chances de recevoir les soins, l'éducation et le soutien dont elle a besoin pour s'épanouir.
When we came to Australia, as I said, we came with a lot of hope. In the country where we're coming from, our daughter had support from different specialists and educators, but the system lacked resources, equipment, or services to fulfill all her needs. A lot of people were telling us that if she was to live in a country with better services, she would have better chances to get the care she needed, the education she needed, and the support she needed.
Ainsi, quand nous sommes arrivés en Australie, nous pensions que ce serait le début d'une vie meilleure pour elle. Nous pensions que parce que l'Australie disposait de systèmes plus solides, de lois plus fortes et de programmes comme le NDS et autres, les choses deviendraient plus faciles. Nous nous attendions à vivre enfin ces rêves, mais la réalité s'est avérée plus compliquée.
So when we arrived in Australia, we thought that it would be the beginning of a better life for her. We thought that because Australia had more solid system, stronger laws, and schemes like NDIS, things would be easier for us. We were expecting to finally live this dream, but the reality was a lot more complicated.
C'était comme si, dans notre parcours vers la solution, nous avons quitté notre vieille pirogue pour embarquer à bord d'un navire moderne, mais sans savoir comment le manipuler, comment il fonctionne, où aller, à qui s'adresser, ni comment expliquer ce dont on a besoin.
It was as if on our way towards a solution, we left our dinghy to embark upon a modern ship, but without knowing how this modern ship was working, where to go, who to talk to, or how to explain our needs.
Très tôt après notre arrivée, notre fille avait manqué un rendez-vous parce qu'il n'avait pas d'interprète. ça n'était que le début. Pendant de nombreux mois, nous n'avons fait que très peu de progrès parce que nous ne comprenions pas le système et que le système ne nous comprenait pas.
Very soon after our arrival, our daughter missed one appointment because there were no interpreters. And that was only the beginning. For many months, we have done very few progress because we didn't understand the system and the system didn't understand us.
Tous les rapports médicaux que nous avions apportés avec nous étaient en français, rédigés en français. Nous devions les traduire en anglais pour obtenir de nouveaux rapports de la part des spécialistes en Australie. Mais pour obtenir ces rapports, il nous fallait savoir qui voir, comment demander, comment expliquer les besoins de notre fille et comment payer pour ce service. Parfois, nous avions l'impression qu'il nous fallait les rapports avant de pouvoir accéder au soutien, mais qu'il nous fallait en même temps du soutien pour obtenir les rapports. Cela créait un cercle vicieux dont il était difficile de s'échapper.
Every medical report that we brought with us were in French language. We had to translate them in English or get new reports from specialists in Australia. But to get these reports, we had to know who to see, how to ask, how to explain our daughter's need, and how to pay for these services. Sometimes we felt like we had to bring reports before accessing support, but then we needed support to be able to get the reports. So that was creating a vicious cycle, which was really hard to escape.
Il y avait des moments où nous savions bien ce qu'il fallait faire, de notre expérience, mais nous ne pouvions pas l'exprimer assez clairement en anglais. Il y avait des moments où nous avions un interprète, mais le sens profond n'était pas transmis. Parfois, les mots étaient traduits, mais l'importance, le fond, l'urgence ou la signification culturelle se perdaient. C'est très difficile lorsque vous essayez de défendre les intérêts d'une personne que vous aimez.
At times, we knew what we had to do, but we couldn't express it clearly enough in English. At times, we had an interpreter, but the deep meaning we didn't go through. Sometimes the words were translated, but the importance, the urgency, or the cultural signification were lost. This is very hard when you're trying to defend the interests of someone you love.
Pour notre famille, l'handicap, une famille comme la nôtre, l'handicap ne touche pas seulement une personne. Comme elle a besoin d'un soutien total, nous devons organiser notre vie autour de ses besoins. Cela affecte le travail, les études, la vie communautaire, les rendez-vous, les transports, les décisions et l'avenir que nous projetons pour nous-mêmes. Lorsque les systèmes sont difficiles à comprendre ou lorsque l'accès linguistique n'est pas correctement planifié, la pression sur les familles devient encore plus grande.
For our family, disability doesn't only impact our daughter. Since she needs full support, we have to organize our life around her needs. That affects work, studies, community life, appointments, transports, decision, and the future that we plan for ourselves. When the systems are hard to understand or where language access is not properly planned, pressure on the families are even greater.
Notre première demande à NDS avait été rejetée. Cela a été très difficile pour nous car nous avions déjà perdu tellement de temps. Le temps compte. Pour une personne handicapée, avec handicap, les retards ne sont pas de simples retards administratifs. Ils peuvent affecter le développement, l'apprentissage, la santé, l'indépendance et le bien-être de la famille.
Our first NDIS application was rejected. It was very difficult for us because we lost so much time already. Time matters. For someone with a disability, delays are not only administrative delays. They can affect development, learning, health, independence, and the wellness of the family.
Les choses ont commencé à changer lorsque nous avons eu des personnes qui nous ont écoutés correctement, qui nous ont aidés à comprendre le processus, nous ont assistés pour les documents et la traduction et nous ont mis en contact avec Amparo Advocacy. Grâce à ce soutien, la demande a finalement été approuvée.
Things started moving when we finally met people who listened to us properly, who helped us to understand the process and supported us for the documents and the translation. and when we were in touch with Emperor Advocacy. Thanks to this support, our NDIS application was finally approved.
Pour moi, cela montre que la participation ne dépend pas uniquement du fait d'être présent dans un processus. Elle dépend de la capacité de ce processus à permettre à la personne de comprendre, de parler, et d'être entendue et d'influencer les résultats.
For me, it proves that participation doesn't only depend on the fact of being invited in a process. It depends on the capacity of this process to allow the person to understand, to speak, to be listened to, and to be able to influence the outcome.
Encore, le NDS, par exemple, n'est pas une fin en soi. C'est un tremplin, un levier. Il devrait aider une personne handicapée à vivre une vie pleine. Mais les personnes et les familles ont besoin de temps et de soutien pour comprendre comment utiliser ce tremplin. Et l'existence des systèmes, si solides soient-ils, ne suffit pas si on n'y a pas accès.
NDIS is not everything. It's a stepping stone. It should help someone with a disability to live a more fulfilled life. But people and the families need time and support to be able to understand how to use this stepping stone. Even if solid systems are in place, it's not enough if we can't access them.
C'est pourquoi une conception significative est importante. Les personnes issues des milieux culturellement et linguistiquement divers, vivant avec un handicap et leurs familles, n'ont pas seulement besoin d'être consultées. Elles ont besoin d'informations, de temps, de confiance et d'une bonne interprétation, une bonne compréhension culturelle et de réelles opportunités de façonner les systèmes dont ils dépendent, qui les concernent.
And that's why a meaningful co-design is so important. People from culturally and linguistically diverse backgrounds living with disability and their families don't only need more than just being consulted. They need information, they need time, they need trust, good interpreting, they need a cultural understanding and real opportunities to be able to change the systems they're involved in.
Nous sommes venus en Australie, encore une fois, avec beaucoup d'espoir, et nous gardons tout cet espoir. En revanche, l'espoir ne devient plus fort que lorsque les systèmes sont conçus avec les gens, et pas seulement pour eux. Merci.
Once again, we came to Australia with hope, and we still have hope. But hope is even stronger when the systems are made with the people and not only for them.
Merci.
Thank you.
Thank you. Thanks, Condi. So before we move on further in the session, can we just pause on what Condi has shared, and particularly the quote that Condi has shared that's on the left hand of the screen. It's a very powerful quote that you need to sacrifice your life. The systems make it much harder to support a child with disability and also to have a life. That sentence says a lot about what happens when systems do not make participation, access, and support easier. So for Condi and his family, arriving in Australia with hopes for safety, opportunity, and a better life for their daughter, but instead of finding a clear and supportive pathway, they encountered systems that required enormous effort, persistence, translation, advocacy, and personal sacrifice. A key point here is that the family's struggle was not because they lacked commitment, intelligence, love, or resilience. It was because the systems are not designed around their reality. That distinction matters. Too often systems interpret difficulty engaging as a problem with the person or family, but what we are hearing is that the system itself creates the difficulty. The hopes and expectations. This captures the gap between hope and reality. So on the left-hand side of the screen, we talk about there's real hope. So For Condi's daughter, Bernadette, she had the opportunity to access special school. Condi advocated strongly, including drawing on the UN Convention on the Rights of Persons with Disabilities. As parents, that represented something profound, the possibility that their daughter would have access to a better life and better support than that had been available before. But then came the reality of engaging with systems like the NDIS. So instead of the system recognising the family's existing evidence, context and expertise, they felt disappointed and frustrated. What should have been a pathway to support became another barrier to navigate. This is important for co-design, as Condi said, because many engagement processes begin with the assumption that if people have been invited, they will naturally be able to participate. But people may arrive carrying exhaustion, disappointment, distrust, trauma, or previous experiences of not being believed. Hope is not enough if the system people enter is still inaccessible. So I just wanted to also share some data as well before we go further on until, so the numbers here tell us that something is wrong. So around 22% of Australians speak a language other than English at home, yet only around 10% of NDIS participants identify as being from a CALD background. In Queensland, that's around 5.2 to 5.3% of participants on the scheme being from a CALD background. Being from a CALD background, CALD backgrounds have similar rates of disability to the general population. So this is not a gap in need, it's a gap in the process. It tells us that people are being missed, delayed, discouraged, or excluded somewhere along the pathway. That exclusion can happen through language barriers, lack of trust, systems that rely on English language information, forms and processes that assume system knowledge, poor interpreter practice, racism, cultural misunderstanding, or engagement models that only reach people already connected to services. That gap is not evidence that CALD communities need less support. It's evidence that systems are not reaching people equitably. Navigating systems and what the research and lived experience tells us. So systems often require specialist reports, which Condi was talking about before, forms, meetings, and explanations. For families from CALD backgrounds, those requirements may involve translation across more than one language, not just of words, but of concepts. So if you think about the concepts and the words, disability, diagnosis, functional capacity, reasonable adjustment, choice and control, psychosocial disability, early intervention, these are not simple concepts. They may not translate directly. They also may not align neatly with the person or family's own cultural understanding of disability, illness, care, family responsibility, or authority. So what gets in the way is on the right-hand side of the screen is often very practical. So poor interpreting, not enough time. Condi, you speak a lot about the not enough time for interpreting.
Yeah, that's because when they give like a 30 minutes or 1 hour, maybe 1 hour for a normal like an appointment, and when I'm helped with an interpreter, actually I use only the half a time, 30 minutes and 30 minutes for interpreter. But it's for that I use 1 hour. It's not a lot.
Condi, you've spoken to me then about having meaning like a 3-hour meaning. So because you're translating it, there's three people in the conversation, maybe more.
Yeah.
And so an hour, you just said you only have then half an hour.
Half hour, half
Half
time.
time.
Every time when we go to maybe to the clinic, to the hospital, to something like everywhere, we only use half time.
Yeah.
Because you need to have time for you, have time for the interpreter. So
And to
every
convey
time,
all
yeah.
of that complex.
yeah, very, very complex.
Yeah, yeah.
Even when I have to discuss the plan with NDS, only use half time, everything half time.
Yeah. So what helps is often very practical that we need to make sure we put in place. So time, as we've just said, patience, quality interpreting, genuine listening, culturally responsive processes, and closing the loop. And we'll talk about that further as we go into this presentation of this community of practice. So meaningful participation requires more than access to the room. It requires access to the meaning of what is happening in that room. We really want to talk about this, our Empire Advocacy's called engagement plan that we have developed. So the called engagement plan has been co-designed with people from culturally and linguistically diverse backgrounds, with disability and their families, from our Empire Advocacy's inclusive leadership network, of which Condi is part of. An important part of, and we have other people from core backgrounds in that network, and inclusive consultants who have designed this called engagement plan. It's intended to guide respectful, inclusive and effective engagement across government and disability sector. The plan is about shifting engagement away from being rushed to being tokenistic or even extractive. Instead, the called engagement plan is about asking us to design engagement that is planned, that is safe, that is respectful, that's culturally responsive, accessible, and accountable. The accountability part is important. Condi and the Inclusive Leadership Network members and the inclusion consultants have told us that they don't want just to be asked for their stories or experiences. They want to know what happened to their input, what they want to see visible action. They want engagement to lead somewhere. So when we talk about co-design today, we're not talking about a workshop technique. We're talking about a different relationship between systems and people with lived experience.
Les problèmes de co-design, nous accordons beaucoup d'importance parce que ça permet aux personnes qui vivent la réalité, qui vivent les problèmes, de pouvoir l'exprimer et normalement pouvoir donner les éléments à ceux qui sont censés pour apporter des solutions. Pas des solutions imaginées, des problèmes inventés, pas inventés mais imaginés.
So the thing with co-design, it's important because it's let the people who are living the reality, issues in real life, express their point of view and give the information to the people who can work on better outcomes.
So Up on the screen, we thought it would be really good to provide some of the statements that Condi and the team have spoken about when they talk about co-design. These statements come from lived experience about the issues that they are walking every day. They describe what good engagement feels like. So I can tell my story without being rushed, interrupted, or talked over. I'm treated as a person who matters, not a problem to be fixed or a box to tick. Things are explained in plain English, and I can say, I don't understand. Being able to use your first language with an interpreter with enough time for real conversation, seeing how your input has been used. What stands out to me is that none of these expectations are unreasonable or complicated. They just require intention, resources, and accountability. They require people designing engagement to think about access before the session, safety, and participation during the session, and follow up after the session. So I'd like to ask a question, because we've been talking a lot, and I'd like to see what your thoughts are about these statements. As you look at these statements, which one do you think our systems most often fail to deliver? And Anna, can I borrow on you?
Yeah, of course. We don't have anything so far.
Sorange, can you repeat your question, please?
Of course, Sahaba. Sahaba? Was that you?
Yes, it's me. Can you repeat the last question, please?
Oh, sorry. Oh, sorry. I thought you asked a question. My
Yes.
bad. As you look at these statements, which one or more do you think our systems most often fail to deliver?
So
Enough time.
Enough time?
Enough time and patience from the other side. Sometimes you feel the difficulties mainly over the phone. So if I'm thinking about my struggle, for example, I'm struggling also with hearing issues. So not always I can understand the other side. So I need to ask for repeat of what they said. Like I was asking you now to repeat your question.
Yes.
So not sometimes you feel it's just the feelings you get that the other side losing patience. So sometimes it's not only the difficulties of understanding the English, sometimes it's other things involve hearing issues, understanding the language, and getting the feeling that the other person had no patience for you.
Mhm.
So enough time and more patient people in the system, mainly over the phone.
Okay, Sahaba, I might just jump in because I just want to check that. Amparo, do you have a few more slides to share? Because we have a
Where
bit of time for Q&A just at the end. Thank you.
Alan, that's the last of the slides.
Okay. Okay, so now and then, thanks so much for your presentations. We now have a bit of time for some questions. Feel free to put them in the chat or raise your hand. If we don't get to your question due to these time constraints, we'll take it on notice. So I think that Kate, you had raised your hand. So if you want to.
I had. Thanks, Lan. And thanks, Ange and Conde. That was brilliant. Really enjoyed it. I guess when I'm looking at those statements there, the one that jumps out at me is the second one. I am treated as a person who matters, not a problem to be fixed or a box to tick. So something I've actually been thinking about for a while is the distinction between diversity and inclusion. And to me, diversity is the intention. And inclusion is the action. So I think too often we're simply a box to tick in the pursuance of diversity, but we're not expected to be heard. We're seen to be there. They want to see us there, but they don't want to hear us. And I think true inclusion is being heard and being considered. And yeah, I really thank Conde for sharing his story there, because I guess those of us who work in the disability space are very aware of what true inclusion is, but seeing it from another perspective was really compelling. So thank you.
Okay, thanks so much, Kate. Look, Seb, unfortunately, we'll have to take your question on notice because we have quite a bit of more material to discuss and cover. But maybe what we could do in our breakout sessions is remember these points about what good engagement looks like. You know, some of these points that both Condi and Angie have raised, we can discuss some of that in the breakout rooms. So on that note, let me go to the breakout room discussion itself. So I'd like you all to think about a time that you have been part of a co-design or engagement process. And as someone who planned, delivered, or participated in it, how did it work for people from culturally and linguistically diverse backgrounds? And they had a disability, and also how did it work with their family members? What would have made it more meaningful for them? So each of the different groups will have a specific focus area. Some of the groups will look at before an engagement, like what needs to happen before the engagement activity to make the participation meaningful for the people from culturally and linguistically diverse backgrounds with disability and their families. And then other groups will talk about during the engagement, you know, what works, what doesn't, what needs to continue, what needs to stop. And then also after an engagement activity, how can we maintain trust, close the loop, and support ongoing leadership? So as you're engaging in these discussions, keep asking what would need to change for people from culturally and linguistically diverse backgrounds with disability and their families to lead engagement, not just attend it, not just be part of some sort of tokenistic tick the box. So in your groups, again, each group will either discuss before, during, or after. So I want you to identify 2 things to stop doing, 2 things to start doing, 1 thing to keep doing, and maybe 1 moment that surprised you. So your breakout room host will guide the discussion with some questions. And so now we'll split into our breakout rooms. And we'll spend maybe about 20 minutes and then come back. Thank you. Okay, it might take a bit of time for the breakout rooms to pop up and for you each to be assigned to your respective breakout room. And in the meantime, feel free to continue putting your questions or comments into
Hello, I can see that we're still just in the main session here, so I will just pop you into some breakout rooms now. Please let me know if anyone has any dramas and can't get in. but just bear with me for a moment.
Thank you.
Are you in a breakout room or the main room?
I think this is a
I'm
break.
not sure.
Hello, everyone. I'm so sorry. I'm just you're just in the little no man's land.
Okay.
Susan, I've got no one who's indicated that they need Auslan, so I'll pop you
That's what I
into
thought.
a sort of main room sort of waiting area. But thank
Okay.
you so much all for your patience.
That's fine. And with Cornelia.
And
Yeah,
Cornelia
there
as
she
well.
is.
Thank you so much.
So, because you'll want us to interpret the last
Yes,
wrap-up
please.
section for
Yes,
the recording?
please.
Sure.
Yeah, yes,
Yep,
please.
happy to wait.
Thank you. Can you pop me on just mute and camera off, please?
Are we there yet?
I'm not sure what's happening.
Sorry. Good morning.
Hello.
Thought I better show myself if I'm talking to you.
You a participant or a host?
I am a participant, well, sort of, on behalf of my son. So I've got a teenage son with cerebral palsy.
Okay. Who's this?
Oh, thank you so much for bearing with me. I'm so sorry. I'm so sorry about that. Still learning Zoom after all this time. I can see someone in here is just listed as a user. And I would. Oh, here we go. I'll just pop you into a room as well. Sorry that it's late. Please feel free just to join in the conversation as much as you can. Oh no, one room only has like 4 people in it. Oh well. Thanks, interpreters. I'll just be here on mute, but please sing out if you need anything.
Hello, folks. Welcome back.
I
I
must
hope
have
everyone's breakout rooms went well, and thank you all for your patience at the very beginning, just trying to make all the breakout rooms happen.
You're welcome.
So everyone will be coming in now.
Oh, sorry.
No, go on.
While we're waiting, so I'll start first. My name is Seb, and I'm been part of the QDN network for a couple of years now, and I've got a background in I'm fully academically trained. I come from an academic background in both social services and mostly community services
Yeah.
overall.
Thank
So,
you, Seb. I think we've got most people back from the breakout rooms now, so I might just hand back over to our host, Elan, if she's here. But thank you. I hope those breakout rooms were really interesting and looking forward to hearing maybe a little bit if we have a minute or two.
Yeah, so yeah, can we start with well, we start with Angie and Condi. What did you hear in your breakout rooms? Maybe they haven't joined in yet. Maybe I can hand it over to Anita. Is Anita here yet?
no, she isn't. They're just
Okay, I think they're still joining. Okay.
I'm back, Elan, if you like.
Okay, I can't see. Is this Kate?
It's Kate. Sorry,
Okay,
I
yeah,
keep
no,
forgetting.
that's cool.
All right.
Fabulous. Kate, if you wanted to share, you know, a couple of takeaways that you got from your group.
All right, thanks, Elan. So my group, we had a really good discussion. Our focus was after the event, and I guess we tended to focus a lot on the actual follow-up of the data and the stories that we hear and what is being done with them after the event. It was raised that perhaps during co-design, all the energy or a lot of the energy tends to go into the preparation and the actual event itself, and not so much in the follow-up and things that occur after the event. So that was one point, I guess. Also, it's the quality of the follow-up. We had a lot of different ideas of how it could actually be done in a way that would make all the participants feel that they're being a part of that group was valued, and that the data will go somewhere. So yeah, so I didn't really have lots to stop. I just had, I guess one thing we're doing is follow up, but we could probably tweak it and make it more of a thing in the whole process, I guess.
Okay.
Is there anyone from my group that feels that we...
Sorry, I'm going to have to cut you off because
All
we're
right.
really short. So maybe can we hear from someone who did the during an engagement? Yes, Sarah.
Thanks, Elan. Very quickly, my group was brilliant, so thank you again for your contribution. A few things that came up were the hour is not sufficient. For example, if you're working with someone from called background, which Condi and Ange both spoke about, so that was definitely mentioned. Another thing that popped up was a lot of the time, potentially it's the parent doing the talking and not the client. And we sort of brought up how because of cultural nuances and different barriers that exist, that's something that we have to learn to navigate as well, and how to best manage that to ensure that the client is the one who's being listened to. The fact that technology has so much potential, you know, AI to use that, but we need to make sure that people are it's still human-centered. Very quickly, the other thing that really was great was one surprise that one of the attendees mentioned was what I thought was co-design wasn't co-design. It was more consultation. And I thought that was a really brilliant comment and something that we all need to sort of consider while we are in the lead up to and also during a program. And there were a few really other great things that were mentioned, but to the lack of time, I will pass it on. Thank you.
Thanks so much, Sarah. Anita.
Yes, thank you, Elan. And thank you again to my group. we were discussing them before. One of the best things that we thought of was, and I love this because it speaks to our humanity, shared humanity, is that we set the intention to be respectful and patient before anyone starts to speak in any language. I think that's very important. And one of the best takeaways that we found is that there are government departments who are taking on having a meeting before the meeting, so that if they are with engineers or nurses, or doesn't matter who's in the meeting, they're actually breaking down the language as much as they can before the meeting proper actually starts. And I thought that was a genuine gem. Thank you.
Fabulous. The pre-meeting meeting to get everyone really aware, and yeah.
Alan, you're on mute. And Ange is back in the room if you want to go to her for comments as well. Alan,
Right,
you're still on
Ange.
mute.
Oh, Ange, please share your comments.
Thanks, Alan. I got so involved in the conversation that we were having that I took some very scatty notes. So I apologise, but some of the gold that came out of it was also similar to, one of the comments was similar to what Anita just talked about, was that there was a meeting that was planned, and I hope I'm getting this correctly, that where an interpreter arrived late, but there was an intention to do planning ahead of that discussion and that meeting, but that didn't actually happen. So the recognition that having that process to explain the meeting and context and information that was going to be provided at that meeting is really essential to ensuring that all the information is captured really well during that meeting. It was also really highly spoken about understanding the goals. So where, for example, a person from a culturally and linguistically diverse background is coming into a session, a consultation about policy, for example, it's not sufficient to just invite someone into the room to talk about their commentary and their solutions to a particular policy, but also to understand, to make sure that the goals of that discussion are really clear, what the context is, and definitions, so that people invited into the room can really participate. Yeah.
Look, I'd hate to cut you off there, Angie. I'm sure you got a wealth of even more awesome tips, but I'm going to need to start wrapping up. So maybe you can share your wealth at another time. I'd like to now go to how you can stay involved, and there's many ways that you can stay up to date with our work. So by all means, explore our Disability Reform's website. The website is there. There's lots of information and resources available, and I'll read out the address, which is www.qldcodesignstrategy.qdn.org.au. Also, by all means, attend our co-design training. These sessions are targeted towards people with disability, family members, or carers of someone with a disability, as well as government employees. And the training is being run quarterly in June, September, and December. And registrations for June are currently open. And feel free, by all means, to reach out to our team if you have any questions. The email is admin, ADMIN, @qdn.org.au. And now I would also like to remind anyone, if about the counseling support services. If anything that was discussed today has been challenging or triggering for you, and you feel like you need to talk to someone about this, we have displayed some phone numbers on the screen with a variety of support services. For example, I'll read out, there's Lifeline, and their phone number is 13 11 14, or there's Beyond Blue, which is 1-300 224 636. There's several more, but I realize we're short on time. Again, you can always contact QDN and we can put you in touch with these other counseling support services. So just to close, thank you so much to everyone for coming today. The next community of practice is in 3 months on Thursday, the 20th of August, 2026 at 10 a.m. We've got on the, in here, there's the QR code that you can use to provide your feedback about today's session. We're always actively seeking your input and feedback to make sure that it's as good as it can be. We'll also circulate the link to the recording of today's session when it's uploaded to the website. So again, thank you all very much for coming today. We hope that you found Amparo Advocacy's wealth of knowledge and the other participants' contributions to be of help to you.
Thanks, Alan.
Thank you so much. Thank you so much for joining.
And good morning.